So basic measurements in epidemiology. So till now we had seen that we are studying the epidemiology, and we are investigating the epidemiological studies to certain people, to large population. We are studying the risk of factors, and we are studying different types of factors to what all why we are doing so that we can have the clearance about the health outcome, and we can just give them the prevention strategies so that the health of the population can be improved, and we can have the preventive strategies so that the major health problems should not occur in a particular population, right? So epidemiological measurements, if we are taking into consideration, so we have various clinical indicators and variables where we are talking of. So it can be mortality. These are certain like terms that should be clear to you as epidemiologists and public health professionals. Like mortality means death rate. Morbidity means illness frequency and severity, where we are talking of incidence and prevalence of a disease. Then is the disability, where we are evaluating the functional limitation and impairments of the individual. Natality, birth related metrics like fertility and birth rates. Then disease characteristics, presence, absence, or distribution of specific symptoms and conditions. Health service metrics like medical needs and service utilization. Demographic characteristics, where we talk of age, sex, occupation, education, and socio-economic status of the community. Environmental and contributing factors means exposure to pollutants, housing conditions, and lifestyle behaviors. So, what are the gaps and what are the emerging needs behind this? So, certain areas in our population are underdeveloped, particularly if we talk of psychosocial dimensions of health, and if we talk of subjective well-being or holistic well-being or overall well-being of the individual, where we also talk of quality of life factors. So these aspects require better concepts, better innovative measuring tools, so that we can cover the full spectrum of health. Now, what are the standards for measurement of quality? That is validity, reliability, precision, sensitivity, and specificity. So these standards form the backbone of epidemiological rigor, ensuring their findings are both credible and applicable to public health practice. Next is tools of measurement. Now, what are the we have to measure the health outcomes. So how are we measuring them, and what are the various tools? So tools, we are talking under three heads. Like there are three fundamental tools: rates, ratios, and proportions. If we talk of rate means, like for example, we are talking of any death rate. It can be any infant mortality rate or maternal mortality rate. Where I would use the word mortality, it is death, right? So death rate or the mortality rate. This number of deaths occurring in 1 year divided by mid-year population into 1000. So what are the components? We have a numerator, we have a denominator, we have a time specification, and we have a multiplier. Okay, so that, and this is a rate. Okay, that this is a general definition or a general understanding of what is rate. Now, what are the various categories of rates? So we have various birth rates, death rates. Then specific rates means we are like observing the certain rates, like what is the tuberculosis happening rate, or age related groups are covered, or we are covering certain time periods like annually, monthly, or weekly. And there are certain standard rates also. Standards means age and sex standardized rates. When we talk of ratio, we are having the answer coming as a ratio. For example, ratio of white blood cells to red blood cells is this, like 1 is to 600. Means that there are 600 red blood cells for every one white blood cell. So this is a ratio where we are having the answers in this relationship. Then we are talking of proportion. Proportion means Numerator is a part of denominator, like number of children with scabies upon total number of children in the village. So this is the proportion of children with scabies. So this is rate, ratio, and proportion, where the tools are applied, where these epidemiological studies are done, and we get the answers in these three forms. Number one in this is measurement of mortality.